Okay, let's unpack this. Have you ever felt, like you need a secret decoder ring just to keep up with new technology?
Ooh, definitely. All the time.
Especially when it comes to something as personal, as vital, really, as mental health.
No, exactly.
So today, we're doing a deep dive. It's into a brand new systematic review from the Journal of Occupational Health.
Right.
It's all about trying to classify these digital health technologies for mental well-being. And our mission, sort of, is to give you a clear shortcut, a map, to understanding this incredibly complex and, frankly, fast-moving landscape.
And what's fascinating here, I mean, really striking, is that despite how widely these tools are already being applied, out there in the real world, there hasn't actually been a clear, agreed-upon way to technically classify these digital health technologies for mental health intervention.
Oh, really?
Yeah, it's been a bit of a Wild West, you could say, which makes it pretty difficult to assess their true impact.
So that Wild West image really paints a picture. So what specifically drove the urgency for this kind of classification right now? Was there a trigger?
Well, the need became particularly acute during the COVID-19 pandemic. I mean, widespread teleworking. It profoundly impacted workers' physical and mental health.
Right. We all felt that shift.
Exactly. And this led organizations like the World Health Organization, the WHO, and the International Labor Organization to explicitly call for occupational health services to start integrating digital health tech to support employees.
Okay, that makes sense. And when we talk digital health, we should clarify this isn't just like old school e-health, a basic website with info.
No, not at all.
We're talking about a much broader concept now. It includes everything from, smart devices, the Internet of Things, all the way to advanced computing, big data analytics, AI, even robotics. It's a whole ecosystem.
And speaking of data, a really key concept that underpins a lot of these tools is digital phenotyping.
Okay, digital phenotyping. Break that down for us.
Sure. So think of it as the moment-by-moment quantification of the individual level human phenotype in situ using data from personal digital devices.
Whoa, okay. Simpler terms.
Basically, using your digital footprint, the data from your phone, your watch, to understand your mental state in real time.
Got it. So that could be active data, right? Like stuff you consciously put in, maybe those quick mood check-ins on an app.
Exactly. Those are called ecological momentary assessments. You're actively participating.
Or it could be passive data, stuff that's just captured automatically.
Precisely. Things like accelerometers, tracking your movement, maybe GPS logs, data your devices collect without you even noticing.
Right. And it's worth noting, the study here deliberately looked beyond just digital phenotyping, didn't it? To avoid sort of tunnel vision.
Yeah, they cast a wide net. They wanted the full picture, not just focusing on one type of data collection.
So how did they actually build this classification? It sounds like a massive task.
It was rigorous. They started with a review of existing systematic reviews, so reviewing the reviews.
Meta-analysis, essentially.
Kind of. Then they used the Delphi method, which is basically a structured way to get experts to agree.
Okay. How does that work?
You survey a panel of experts repeatedly. After each round, you aggregate the answers, share them back anonymously, and let the experts refine their views. It helps converge opinions.
And they brought in experts from all over the place.
Oh, yeah. Really diverse fields. Psychology, occupational health, physiology, information science, nursing, ergonomics, the whole gamut. Trying to integrate and systematize everything used or, expected soon in mental health tech.
Okay, so after all that work, they landed on 11 categories. What are some highlights? Anything surprising? Or maybe expected?
Well, some are pretty common, things already in practical use, like number 1, heart rate estimation from wearables.
Sure, most fitness trackers do that.
Right. And number 2, tracking exercise or physical activity, super important for prevention. There are studies showing, for instance, just 1 hour of exercise a week is linked to something like a 12% lower incidence of future depression.
Wow, only an hour. That's powerful.
It is. And linked to that, number 3, sleep estimation. Also vital for prevention. Insomnia, for example, roughly doubles your risk of depression.
Okay, so heart rate, exercise, sleep. Pretty established. What about the newer stuff?
Yeah, then you get into emerging and more advanced categories, like contactless heart rate or pulse wave estimation, using cameras, maybe?
Interesting. So no wearable needed.
Potentially, yeah. Effectiveness is being reported. Then there's voice and emotion analysis using microphones and cameras, like on your phone, expected to become quite frequent for estimating mood.
That feels a bit sci-fi, but I guess the tech is getting there.
Yeah.
It's amazing how broad this is. So beyond just sensing and preventing, how do these tools step into actual treatment or management?
Right, that brings us to the therapeutic and management buckets, things like self-care apps or tools for cognitive behavioral therapy, CBT, or mindfulness.
Delivered online, I assume.
Increasingly internet or app-based, yeah. And sometimes delivered by chatbots or, actual online therapists. Also, dietary management tools. Digital help for eating disorders has shown promise, and we expect more online and app approaches there too.
Okay. And then you mentioned organizational and future frontiers. That sounds intriguing.
Yeah, this is where it gets quite innovative. They included psychological safety.
How's that a tech category?
Well, it highlights that organizational efforts are key for mental health. So, interventions like, say, crew resource management, which started in aviation to improve teamwork and safety,
Okay.
might be offered via apps to boost psychological safety in any workplace, making the workplace itself healthier.
That's a really interesting angle.
Yeah.
What else is on the future frontier?
Communication robots. Think AI-powered chatbots, but also maybe therapeutic animal-like robots or even robot therapy. Still early days, but being considered.
Robots for therapy.
And then avatar or metaverse devices. Now, the efficacy isn't totally clear yet for things like avatar therapy,
Right, the metaverse is still pretty new.
but it's included because of future potential, especially as AI gets better. And finally, brainwave devices. Not widely used yet, but on the horizon with tech innovations.
That's quite a list. 11 categories covering so much ground. What's the big takeaway? The significance of nailing down these categories.
What's really significant is that these 11 categories are seen as socially implementable, like actually usable,
Quite tactical.
and useful for mental health interventions right now or very soon. This whole systematization, it helps us spot trends, right? And it feeds into future studies, policymaking.
Gives everyone a common language.
Exactly. And from that occupational health perspective, the study really underscores a need for employer-initiated organizational interventions. Not just tools for individual workers to use on their own, it's about systemic support within the workplace.
That's a crucial point. It's not just about individual resilience, but the environment.
Precisely. And if we connect this to the bigger picture, look, this systematization is great, but it's also kind of a snapshot, right? And a temporary classification. It's designed to evolve.
Because the tech moves so fast.
Exactly. And while individual digital tools are popping up everywhere, the employer-friendly tools, the ones for organizational change, they're lagging behind. Developers really need encouragement, maybe incentives, to focus there, too.
So what does this all mean? We've basically just mapped out this whole landscape of digital health tools for mental well-being, from sensors you wear to these emerging virtual worlds. It gives you, the listener, a framework, hopefully, to understand this field.
Yeah, a starting point at least.
Which leads us to a pretty interesting question about what's next. Because here's where it gets really interesting. Digital health technology will absolutely continue to evolve, probably faster than we expect. So, what do you think is the next big digital leap in mental health? And maybe more importantly, how can we make sure these innovations truly serve everyone equitably? Something to think about.